A drugs company has refused to give in to pressure from a father who wants them to give a potentially life-saving treatment to his terminally ill daughter.
I don't want it anymore. Shire, you want to have the money? Here it is.
Well, William Massart, who's from Belgium, says he raised €1 million to pay for an experimental drug which could be used to treat his daughter, Sandra. The 7-year-old suffers from a rare brain condition which is likely to prove fatal. The British-based firm concerned says it doesn't have enough of the drug, which costs £44,000 a month for each patient. Well, William Massart joins us now from Basingstoke following his meeting with the drugs company bosses, with his family as well. William, thank you very much indeed for joining us on Sky News. First of all, how is your little girl?
Well, she's very happy to see me again. It's been 3 days I've been away from her, and she's really happy. Thank you.
What is her condition? Can you explain it to us in layman's terms?
Yes, she has a disease which is causing breakdown of her nervous system, and this will eventually lead, well, to mortality. She's condemned.
And this drug that we have been talking about, what difference would it make?
Well, the drug only does one thing: stop further progress. And every minute that we lose now is a minute too much. So I've been asking to get this drug for 1.5 years now, and still I don't get it. I can't believe this.
What have they said to you?
Well, they said to me, we can't make enough of it. And 1.5 years ago, they said to me, you can buy it. A few months later, I got a quotation saying they could deliver it in 2 days. So I don't understand this. What's more, I hear that some other parents were able to buy it, and that's something I don't understand. Why can they buy it, and why can they buy it, and why cannot I not? I feel discriminated. I feel betrayed by this industry.
So the drug company involved are based in Basingstoke. They told you in writing that you could buy this drug from them for €1 million. You raised the money, and now they're saying you can't have it.
Well, Shire told me that they cannot make it, but I have a quotation from the distributor, the UK distributor called IDIS. And for me, it's all the same who makes it. Be it Shire or any other manufacturer, I don't care. It's been promised, the distributor gave me the quotation, and I want to buy it, and they still say no.
So who are you most upset with, William, just so we can clarify this? Are you upset with Shire, or are you upset with the distributor?
No, I'm upset with the pharmaceutical industry. They have not done this right. They made me a promise, they gave me quotations, they make me raise €1 million. This is money from the Belgian people that wanted to help us. And now they say, sorry, we cannot deliver the product. I don't understand that.
What's happening to the product? Why can they not give it to you?
Well, they're saying they're going to produce more, but they're going to reserve it to further test it on other patients. I asked them, if you're going to produce it, why don't you sell some to me? And they said, no, we're not going to do this. So they're going to leave my daughter to die, and I protest that.
Why won't they sell it to you?
Why did they don't sell it to me? I don't know. I don't understand.
It's a very difficult time for the whole family. I know that your wife is there with you. She can't actually hear what I'm saying. She doesn't have one of those clever little earpieces that you've got in. But I wondered if you could ask her what the impact of all this has been on the family.
Okay, Olga, they ask you, how do you feel about all that's happened to us the last 1.5 years? Say, tell them. My wife is so shocked about the answer. She was just crying. Please forgive us. This is too much of an emotion to us. You must understand, please.
I can see that it's an incredibly difficult time for all of you. What's going to happen? I'm sorry to have upset your wife. Do express my concern about that. But I wondered what you're going to do now, William. How are you going to take this forward?
Well, I demand justice. I've walked 3 days to get justice here in the UK. I thought that justice is a big issue in the UK, more than in Belgium. and I had hoped that this would help, but apparently not. So I have to reconsider everything again, and I will continue until I get justice.
How much longer does your little girl have before she absolutely needs to have this drug?
Well, a few more months, and she will go into the vegetative state, and then what? Is it then still worth it? So I have to react quickly. I want this drug now. I need it now.
How aware is she of what's... There, she's smiling. How aware is she of what's happening around her?
Oh, well, she's well aware. I can tell her jokes and she makes fun. She can enjoy it a lot. We every evening I tell her stories. She enjoys it. It's quality time, and I want to keep it this way. I'm very happy. She has never been as happy as now. Just with the contact she has now closer than ever, and we want to keep it like this. So we need the medicine.
But you're going to carry on fighting on her behalf?
Absolutely. I've been betrayed by this industry. I've been betrayed. I cannot believe this. What this industry is doing to us. No, I'm going to fight back, believe me.
Okay. Well, we'll let you carry on and look after your family. William, thank you very much indeed for joining us.
You're welcome. Thank you.
News at sky.com 84501. Let us know what you think. He's raised €1 million with the Belgian people, and the drug company is now saying you can't have it. We're going to talk to them and see what they have to say in response. In the meantime, we'd like to know what you think. 84501. News at sky.com. Still to come.
The father of a dying 7-year-old girl has flown from Belgium to Britain in his fight for drugs that could save her life. William Massart says the pharmaceutical company Shire is denying his daughter Sandra the life-saving treatment, despite the fact he raised €1 million to buy it. And Brady reports.
Saving drugs to help his daughter Sandra in return for €1 million. He raised the money inside 2 weeks. But the Hampshire-based pharmaceutical company working on the experimental treatment insists they made no such promise and can't deliver what they don't have.
It's been a long, long fight. It's just to have and see her go downhill all the time, knowing there's a medicine out there. It's just horrible. It's just horrible. And many people say give up on her. I will not do it.
Sandra's plight has touched the heart of the nation back home in her native Belgium. She even received a visit from Princess Astrid, who has followed her situation closely. Sandra's one of only 2,000 sufferers worldwide of the neurological disease Metachromatic Leukodystrofie. It's a rare disease in which the lack of a key enzyme causes loss of the protective sheath from the brain. Symptoms include muscle wasting, blindness and dementia. Children may become comatose. In all cases, this is a terminal illness. An experimental drug called Metazyme is the only therapy which offers any hope for Sandra. Without it, she may lapse into a vegetative state within months. Treatment costs around £44,000 per month. The Massarts say a pharmaceutical company promised to sell it to them if they could raise the money. Shire now say they're unable to supply the drugs because they need the whole stock for clinical trials.
The simple reality is that unfortunately we just do not have any of this drug available to give outside of the small number who we have in the trial at the moment. We absolutely empathise with Mr. Massart and his family. They're in a very distressful situation, and as I said early on, really at Shire we are working tirelessly to try and accelerate this clinical trial programme so we can try and bring this medication onto the market as soon as possible.
Mr. Massart met with the company's management, but left without the drugs he'd come here for.
I'm asking them, you're producing it, why don't you sell it to me then? They said, sorry, it's reserved for the other children. I don't accept that. I will fight it.
For the Massart family, this money is effectively useless. They say they'll fight on, but they know that time is an even more precious commodity. Enda Brady, Sky News, Basingstoke.